So an inguinal hernia is a bulge or a defect developing in the groin. This is a normal defect that we have from childhood because if you're a male, that's where your testicles descend through the groin into the scrotum. And in females, the round ligament of the uterus is suspended in an inguinal canal. It's called the inguinal canal. And these hernias can develop when you're young and adolescent, but they can also develop when you are in the adult age bracket. And it's because you either have a weakness already still there, or you develop a weakness because of either your profession or advancing age. So it's a normal weakness that we have during development that usually closes off, but it often opens up. And they are the commonest type of hernias. Most patients who develop an inguinal hernia usually feel a bulge in the groin, and that's your first real positive sign that you have a hernia. Early symptoms are burning or stinging or an ache in the testicles, and those are the early signs of an inguinal hernia. So as I said previously, the early symptoms of an inguinal hernia are burning or stinging in the groin. You can sometimes get an ache in the testicle on the side that the hernia is developing. And some patients who do a lot of driving, they find that they have a bulging feeling or an ache in the groin when they're doing lots of driving. So they're the early signs. As a hernia develops, you see a bulge. It's an obvious bulge where your groin is. And then as a hernia develops bigger, you find that the bulge goes down into your testicles, into your scrotum. And so patients find that their scrotum is enlarging. And that's called an inguinoscrotal hernia. That's an inguinal hernia that goes into your scrotum. In ladies, you often find just a bulge where your groin is. But inguinal hernias in ladies are not very common. And actually, those are more important to treat because they have higher risk of complications. So we usually like to treat those sooner rather than later. And all the European Hernia Society guidelines say that we should do that. Yeah, so most inguinal hernias are treated with either keyhole surgery or traditional open surgery. Open surgery is a cut in the groin. It's usually a small cut in the groin over where the bulge is, and we push the hernia back inside. We separate it from the spermatic cord, and then we strengthen your muscles with a mesh. The other way of doing it surgically is with keyhole surgery, where we put a port, 10mm port just near the belly button, and then some other little 5mm ports to allow us to put instruments inside your tummy, and then we fix the hernia from underneath. So we pull the hernia inside, we separate it from all the structures, and then we usually put a mesh in between your abdominal wall muscles and glue that in place. And both of those are the surgical approaches. And in patients who are not fit for surgery or who don't want surgery, there are some nice truss or undergarments that you can buy on websites that have sponges which keep the hernia back inside. And for patients who are unfit for surgery, I usually recommend these. That's a good question. So the two approaches of surgery have slightly different recoveries. So the open approach is obviously a cut in the groin, and the muscles are separated to be able to put a mesh in. That tends to be more painful, and all the guidelines are for no heavy lifting for 6 weeks, because it takes 6 weeks for the muscles and the tissues to grow into the mesh and for you to be for you to have the maximum strength. Keyhole surgery usually has a recovery of about 2 weeks quicker. A lot of athletes prefer to have keyhole surgery because they can start doing light training after a couple of weeks, and that's light jogging, light cycling, but no heavy lifting. And for both surgeries, we really don't want any heavy lifting or yoga, Pilates, or anything that really switches on the core muscles for 4 to 6 weeks. Inguinal hernias are a defect in the abdominal wall muscles and in the tissues. So they don't go on their own. It's not something that physio can reduce. However, if you have a weakness in the muscles, that's sometimes called a posterior wall weakness, you can strengthen that with physio, but a true hernia will never really go away without surgery.